Once again in Diamond Diagnostic Center, we solve all your health problems such as prostate problems, infertility, you've been married for so long and no fruit of the womb, low sperm count, stomach ulcer, fibroid, liver and kidney problems. If you have all these problems and more, do make a date with Dr. Marina on Health Solution for deep medical science facts and home remedy.
Hello, our viewers. We are continue our cycle of the programs which can be explained about the diseases which is not detectable. Today we will discuss about infertility issue. We know about our center is a natural infertility fertilization center. We are doing a treatment for infertility issue, and today we want to discuss which of the points can cause infertility and how it can be dissolved. We can start from the structure of the reproductive organs. We have two ovaries, we have fallopian tubes, and we have a womb in the middle. Then we have a cervix with a barrier which is going to vagina. For fertilization, the sperm, the seeds from the male supposed to enter through vagina, pass the cervix mucosa and enter inside to the womb, and inside in the fallopian tube supposed to meet the egg which can be fertilized. What is necessary to make fertilization? Number one, need that the egg will be produced from the ovary. For that reason, a lot of women doing additionally test for the production of the eggs. Ladies supposed to come and do the test. Number one, for fertility hormones. This is follicle stimulated, lutein hormone, estrogen and progesterone. This is fertility hormones. The hormones which can have a negative impact for that mentioned above hormones. This is a testosterone which is neutralized the woman hormone estrogen, and it can be the prolactin which is the same neutralize the progesterone and estrogen for fertilization. This is a hormone test which is supposed to be done. The second, need to do hysteroscopy and study the condition of the fallopian tubes. If the lady has some of the inflammation previously, they have in the history pelvic inflammatory disease. The lady has a vaginal discharge, white, yellow, gray, creamy, and another watering discharge. All of them, it is caused by pathological bacteria and mucus inside, and some epithelium cells which is inside in the womb or inside in the fallopian tubes. And when that bacterial infection is present, it is caused inflammation. Inflammation, it is the swelling, and cumulative tissue which is inside can block the tubes, and the tubes has a blockage, and the egg doesn't have a chance to flow inside to the womb. And it can cause different issue that fertilization is not possible. The third point which is going there, it is, we mentioned, presence of the pathological bacteria, PID, which is blocking the tube. Absent hormone imbalance. Then we mentioned that maybe the ovaries is not functioning well. Maybe the lady has an ovarian cyst or polycystic ovaries. That disease can be detected by the scan. When we are doing ultrasound scan, we detect that the lady has a ovary is just enlarged, or they have multiple, like a grape, some of the cysts growing there. All that cyst, it is just blocking the way for the egg, for the corpus luteum to pass it inside to the tube and just to move the egg for fertilization. Then we're supposed to mention a next point. If we are coming to the scan, it can be a uterine fibroid. If the fibroid, independent of the location, growing inside just in the muscles of the womb, it doesn't affect anything.
Yes.
But if it is growing like a subserosal close to the fallopian tube, it is growing bigger and blocking the way for the egg to move out, and it is blocking the way for the spermatozoids just to move inside to the tube to meet the egg.
Yes.
Then we are going for the next point, like fibroids can be inside in the submucosal.
Yes.
Submucosal fibroid, it doesn't give chance for for implantation of the fertilized egg, and the egg is just flowing out and cause that fertility is not available. To protect and prevent it, that lady is supposed to go and check all that points, and we give medication for them.
Yes.
Then I want to take a special attention that we are talking about if the spermatozoid is functioning normally, but the sperm is not entering inside. It can be like thickness of mucosa
at the
cervical entrance. It is very, very thick.
Yes.
And the spermatozoid is so weak to penetrate inside.
That is it.
Some of the flora inside in the vagina can be hyperacidity because metabolism inside and the flora inside vagina. Some of the ladies use additional herbal washing and another.
Products.
When the sperma, which is alkaline, entering inside, it is just dying.
Because of the hyperacidity.
Hyperacidity, and they just dying and staying inside or sleeping and waiting when the flora will be changed.
Yes.
The presence of pathological bacteria inside vagina, the same blocking and make a blockage of the way that the spermatozoid could penetrate.
One interesting aspect about this infertility.
Okay.
You see, it starts from a younger age. When the females, especially our young ladies, are at the secondary school,
Okay.
we talked about the vaginal discharge. They always have the white. They will treat, after 2-3 months, it comes back. And they stay in the school like for 5 to 6 years through the university. That these discharges, which are mucus, forming in the pelvis, especially the fallopian tubes, at the time that they get married, we are seeing blockage. It is very interesting that the young ladies who are listening to us must pay particular attention that when at the secondary school they are having these discharges
That need to come and check.
Yes, from the pathological bacteria staying in the pelvis and causing pelvic inflammatory disease.
That pelvic inflammatory disease can be developed and create in the childhood when the lady in the pubertative period stay in the secondary school, stay in the boarding school, and it is very popular in their age that a lot of vaginal discharge is coming and nobody take attention for it. And when she is coming to marriage, it is already caused the blockage of the fallopian tubes that the possibility of fertilization stay impossible.
It is very critical, and a lot of young ladies who have issues with fertility, the root cause is this, the vaginal discharge.
This is really very important, that to know that ladies who have vaginal discharge and their parents take attention. If you want that your lady will be successful in the marriage, that the grandchildren will come, you need to take attention in the childhood.
At the early stage, that they are going for checkup. And you mentioned fibroid. Fibroid do not develop in 1 month. It doesn't develop in 2 months. It is starting very small.
Which is like a seed.
At the young age. If it is detected early, we have the solution.
Yes, we have solution and prevention. We have a medicine which can even prevent the fibroid, even if it is small. It will, our medicine will be prevent, and just if it is big, it will shrink, and if it is just a seed, it will be protect that it doesn't grow big and doesn't affect the organs inside.
Yes.
Because when the fibroid is grow, it is just affected urine bladder, affected ureter, that it is create another diseases.
Yes, because I came in to add these points, because a lot of infertility issues, young marriages breaking up, and then young couples who have problem with their families are as a result of a condition that started maybe 5 years ago.
In the
before
childhood.
marriage, in the childhood. from puberty age through secondary school through to university, they are getting fallopian tube blockage and fibroids. Now we mentioned issues about the female infertility. What can happen in the male that they can also
Now we are
have
coming
problems?
that about the male.
Yes.
Some time back, I had fertility problems. I experienced a number of miscarriages. Due to that, I had to visit the hospital. I was told I had fibroid. I visited several hospitals but never had solution to my problem. One day I was watching the telly. I saw Dr. Marina's program on the TV. I picked a number and I called. I visited her, and honestly, she cured my fibroid without operating on me. 2 to 3 months later, I discovered I was pregnant. And thank God, today I also have a very beautiful baby girl.
How we know, like the male has a seeds,
Yes.
and the seeds just producing inside in the testes. Inside testes is just protecting and stay inside in the scrotum. If it is producing inside in the testes, the seeds is just producing, how I know it is a 60 days, it's not 1 day. It is just the hormones producing the same inside in the pituitary
Yes, it
gland,
takes time.
the same like for the
Mature.
woman, like follicle stimulating hormones, plus additionally it is going another hormones which is just, even the man has the same hormones like estrogen, the same
Yes, but of lower quantity than the female.
low quantities, but they have the same.
And very high estrogen compared to the female.
If the high estrogen is there, it is create the infertility.
Yes.
Need to have a high level of testosterone. Then additionally, it is creating in the
Yes, the
scrotum.
testosterone is higher in the male.
And the same prolactin, how we
Yes.
tell that the same affected infertility with the woman
Okay.
and affected infertility with the man, the same. And the man, the same, can have high prolactin and they have a high estrogen, and need to check all that fertility hormones for male and for female, need to do almost the same.
Okay.
Because all the time how we work with our fertility couples, who is coming with the infertility issue, all of them complain the same.
Yes.
That problem is only with the woman. The man
This
is
is
just
our belief.
telling that
Our culture is not part of it.
man doesn't be affected with anything. But the tropical environment create the problem for both
Okay.
of the partners.
Okay, yes.
This is why we invite everybody that if you want to treat infertility, come together, come with the couple that need to check woman and need to check the man. We start discuss about that the sperm, the seeds is producing inside in the testicles. From testicles, it's supposed to go to the epididymitis and just entering inside and keeping there during 20 days. That it is a long stream where the seeds is just entering, keeping, and through the spermatic cord is entering inside to the vesicle, where it will be keeping till that time when the man has erection and ejaculation. That when it is take the sperm and together with the liquid which is producing prostate gland, supposed to be evacuate out inside to vagina where they are going for fertilization. Now, if we are talking about the male infertility, need to check the quality of the sperm. And you are the specialist for that quality. That we need to check motility, need to check viscosity, need to check some of the thickness.
Even agglutination, we have one aspect that some of the sperms are sticking together.
Like a glue.
Like a glue, because for fertilization to take place, the spermatozoa has to move
One by
and
one.
travel one by one to enter the egg before fertilization can take place. What we realized, or normally, about male infertility, when they go to the hospital and the sperm number is more than 20 million, they think they are okay.
They're okay, of course.
This is
Every
what they
doctor,
It's
because
telling you have normal sperm
no,
count.
because where they are going for the center, where they are telling them that need to make IVF.
IVF.
For IVF, never mind how many, you can have 20 pieces of the spermatozoa,
and they just pick it and make infertility artificial fertilization. This is for artificial fertilization, but if you want to have a fertilization naturally, that you need to have
You have a good number,
uh-huh,
not necessarily the number, but a good sperm. What is a good
the
sperm?
quality.
During the semen analysis, you look at the structure of the spermatozoa because it must have the head, the tail for movement, and the middle piece, which contains what we call mitochondria, to give it the energy. So, in looking at the number, you look at the quality of the spermatozoa, that you look for motility, how fast it is moving. Sometimes you look on the slide, you see slowly moving, we call it the sludge. This, you can have over 60 million, you can have 100 million number, but if they are moving slowly, no fertilization will come. And if they are sticking together, no fertilization will come because they cannot move. Then one interesting aspect, sometimes you are seeing a larger number, but you look at the spermatozoa, you will not see the head. The head is cut off. Sometimes you look, you see the head. You
Oh,
don't
it is
see
somebody catch them.
what is catching them.
It is like
another
it is
interesting
like
aspect.
it is just. I remember when we see the cat, which is just sitting on the drum and inside water, and people put the fish inside. They are just sitting, and what they are doing, moving, and pick the fish out and catch the head only,
Okay.
and the fish stay jumping.
Mhm.
This is happening the same with
the
the
same.
It means somebody sitting there and just eat the head and cut the head.
Very good. It is therefore important that when you do the semen analysis and we detect these problems, then we have to find out the root cause. Why you have the spermatozoa which has no head? Why you have the spermatozoa which has no tail? It means something is wrong and we need to investigate. This is the semen analysis. After looking at the number, you look at the quality. Quality involves movement and then the structure,
The
that
shape.
everything is correct. And in our research, looking at laboratory investigations from the semen analysis and all that, when you do the semen analysis, sometimes you see a lot of past cells.
No, it is infection, inflammation.
Infections coming from which pathological bacteria which can stay.
No, that pathological bacteria is how we understand that we advise, like in our facility, we are doing a part of the full blood count, semen analysis, urine test. We are doing a scan of the scrotum. It is not every facility has a specialist who knows about that scrotum scan.
Okay.
And inside in the scrotum scan, how I mentioned that epididymis, where the sperm supposed to be keeping. If it is infection or inflammation inside, it can be some of the pathological bacteria there which is make deformation of the sperm and the seeds.
Okay.
This is like a different type of pathological
It
bacteria.
means it is the bacteria which is
Yes,
acting
make
like the arm robbers, catching the head
Yes,
and catching the tail.
Yes.
This is very interesting. And therefore, if you are treating a patient with this problem, it means you need to treat the pathological
bacteria.
infection.
Of course, need to treat pathological bacteria. This is why we just invite the couple that male infertility in African countries, it is 70% of cases. This is why we take a serious attention that the man supposed to come for checkup. If the lady has couldn't conceive, that maybe the problem is not with the lady. Problem can be with the male
The
side.
Yes.
Male side. Now, the people asking us, is it like heredity problems that it is coming through the genetical points, or it is just how we mentioned that if it is pathological bacteria, it means that heredity is nothing.
No.
It doesn't affect anything.
Yes,
that
because-
need to care of yourself.
To prevent infections, that when you have the infection, you treat it earlier.
Yes, this is what we just, I remember we have one of the cases that 17 years boy came to us from some of the African country. And when we did a scan of the scrotum, and the pathological bacteria just dissolve the testis itself. A part of the testis, it is stay jelly inside. And how we understood that now it is infertility from the, this pubertative period is created already. How we just mentioned that during the school time need to take attention for the boys and need to take attention for the ladies. If they have any discharge, if they have any of the scrotum pain, if they feel any discomfort inside in the urethra, need to take attention and just immediately come to the hospital and detect what is going on. Because this is the future of reproductivity. The same we can just mention for the man who has the experience with the different wives, different ladies, that different partners, that it can be reinfection all the time.
From all the partners, it could even be this yeast infection. People don't know that the man can also have the candida infection.
I'm surprised because we are always mentioned that if one of the partner has this bacterial infection through the intercourse together with the sperm, that pathological bacteria, yeast cells, fungals and other, it is just together with the sperm entering inside to the woman.
Yes.
And through the bloodstream, it is affected her, affected kidney, affected in other organs, develop and create that pelvic inflammatory disease, which is caused fallopian tube blockage. And finally, who is just bring the problem? The man bring the problem.
Yes.
But everything is just coming to the woman's head.
Doctor, how do we treat in our center? Because we mentioned for the females about hormonal imbalance. Then we talked about fallopian tube blockage and then fibroid. Do we have treatment in the alternative way?
Yes, we are just offer, because we are alternative medicine specialist clinic. And like a clinic, like a specialist hospital, we not only helping people naturally make a fertilization and receive and conceive. We are giving the solution to stabilize the hormonal imbalance.
Okay.
We detect which type of the hormones has imbalance. If it is inside in the pituitary gland producing, it is a one type of treatment. If it is just ovaries is not functioning well, or it is estrogen is going so high, or maybe it is progesterone is going high, sometimes all that hormones has a different imbalance. People who has diabetes, the same affected. People who have thyroid problems or problem, we have a part of it, we have additional adrenal glands which is producing another fertility hormones there. And the same problem with the adrenal glands, it's producing and create another additional problems. We don't mention it today, but it is additional points for the infertility issue. We have natural treatment, and you need to follow all our instructions. This is the first. The second, you need always understand that everybody knows about lady has ovulation. Okay. And coming and telling, Madam, I don't know when my ovulation coming.
This is based on research, but we have the individual difference. You understand? Because if they are telling ovulation is coming middle of the month, someone can have ovulation at the beginning of the month. This is individual difference, but they are always thinking that it is only at the middle part of the month.
Because of the internet, now all the solution and all the diseases, it is just Google.
Okay.
Google give you disease, Google give you the solution. And if you follow Google solution, Google supposed to give you the baby. But you are coming to us for help. And we are so happy that you are follow the right way. Okay. That we are really make analysis, find where the problem is, and we are giving you the solution. Okay. That need to follow all instructions. Some of the people necessary to change the diet. Some of them need to take medication to treat the problem inside in the scrotum, inside in the vesicles where the sperm is producing. If they have inflammation in the scrotum, epididymitis, necessary to treat pathological bacteria with the man side. Then if they have problem and inflammation with the prostate, enlargement, hypertrophy and other hyperplasia, different problems with the prostate and inflammation around, which is called prostatitis, need to take another medication specially for the prostate. We have all medicine to boost spermatogenesis. We have a medicine to dissolve and shrink the fibroids and ovarian cysts, if it is with the ladies. If they have problem with the high prolactin, we have another medicine to stabilize the prolactin level. We have medicine to boost testosterone for the male aspect. If they have enlargement of prostate, we have medicine to shrink the prostate. If it is necessary and we have obstruction of the spermatic cord, where the sperm from the scrotum couldn't enter up and make ejaculation together with the sperm, spermatic obstruction, spermatic cord obstruction, we have a special physiotherapy procedures to clean the spermatic cord, that the way will be open and the cyst is easily flow and fertilize the eggs. Now, how we summarize everything? That we have problems with the infertility, both partners must come. Do the full checkup and investigation at our center, and follow all instructions. Buy the medicine during 1, 2, 3 months. If it is not genetical problems, you can fertilize and conceive easily and successfully. Then after that, we'll stay a matter to save the fetus, and we have a solution for that point too. That the lady successfully carry the baby and has a normal delivery in term. You're welcome to our place, and we are just invite everybody who has that problems and take attention and stay with us, that we will continue our cycle of the programs just together with the Dr. Joshua Santi, who is helping us with the biomedical scientists, with the scientific researches, with the pharmacology researches of our herbal combinations. That stay with us. Welcome to our place.